Okay, so we're going to demonstrate dry needling for the lower back. In this instance, a person coming in with low back pain, ache, stiffness, or any other mixed match of back pains, needling can be effective, okay? And just for the purposes of this video, we're going to have a feel of Stephen's lower back muscles. He doesn't really have much going on here, but you swab with an alcohol swab, and often you will make sure that the glute is happy as well, that the glutes are happy. So just for the purposes of the video, we're going to show you. So again, our muscle fibers run up and down like this. Some of them fan at different angles a little bit. So we feel across the muscle fibers. This technique is completely safe, all right? Number one, this is the biggest concern about people is like, what about if you go the wrong way, or if it hits off a disc or a nerve? It's not going to happen because of, we know our anatomy and we know that the orientation of the needle goes in a safe angle, and this is what we've been trained to do. Okay, so that's the first thing. So you go in at a slight oblique angle, in towards the muscle, or in through the muscle, until you've identified your spasm point, which may be causing the pain. And so you just pop that in here, and in it goes. Bit of a twitch on that one. Okay, so you can still get the twitches, and look, it's totally safe. In it goes, and that's 3 centimeters into the muscle, because this is a 4 centimeter needle. Okay, and it's totally fine, apart from the few twitches that Stephen wasn't expecting. But they're sore, and they're an automatic response, so they're always a bit twitchy. But once you get used to needling, it's very effective, and there's probably going to be a little bit of this too. So in it goes, and you feel a couple of little mini flicks in the muscle underneath, and that's all good. And people ask, am I going to be sore after needling as well? And the answer is, you might feel a little bit achy. And the reason for that is because if the muscle is storing tension, there's a lot of chemicals that cause the muscle to contract or to be knotted, and those chemicals in that muscle are released. Okay, and they're pain chemicals, and we could list off all the lists of them, but they cause pain in themselves because they're released around the area. But then a little bit of light movement will alleviate that and reduce it. And the needling itself, there's a little bit of micro trauma. It's very, very minute, but that causes a little bit of that bruisey, achy sensation in the muscle. And again, that's a normal thing from either deep tissue work or this, or any other hands-on treatments for that matter. We call it post-treatment soreness. Okay, and there's definitely a bit of action going on here in Stephen's glute as well. We can just feel, as I palpate across there, you can see a twitch response through the line of that muscle there, and we'll get that easy enough there now with the angle. So I'm just looking for the spasm point. Okay, and he's feeling that there as well, and I'm going after that spasm point in this instance. So and we leave that sit then. Okay, so we're treating left low back, left glute, because all that part is connected together, part of how we are all connected. And we could chase that down the leg or the calf, up this side of the back or to the other shoulder. So in our assessments, we do check all those things to make sure that all the body parts are connecting and working together properly. So that's dry needling for the lower back.